So, I have a PPE on. Is the scene safe?
Seat is safe.
Okay. I have one patient, right?
Yep.
What was the nature of illness?
Patient is having difficulty breathing.
Difficulty breathing? Okay. I'm going to think about C-spine at this time and ask for ALS assistance if I need it. Then what I'm going to do, I'm going to get my general impression of what am I seeing here.
You see little Timmy here just how he is. He's having a hard time breathing, and he just looks at you for help.
Okay. So he's laying down is what you're saying here?
Yes.
Okay. Getting my AVPU, is he able to talk to me here?
He is. It's just 1 or 2 words of breath.
1 or 2 words of breath, okay. Does he take any medications?
No.
He doesn't take any medications? Okay. So I've got my AVPU, chief complaint of respiratory distress. I'm going to get a pulse here in his right radial.
It's rapid.
Rapid, is it thready, strong?
Strong.
Strong, okay. I'm going to look at the skin condition. Does he look pale? Does he look normal?
Looks blotchy.
Blotchy, okay. Looking at the respiratory rate, what would we say the rate is?
It's labored, and he's trying to take rapid shallow breaths.
Rapid shallow breaths. Do I see nasal flaring?
No.
Accessory?
You do see accessory muscle usage.
Okay. Is he, do I hear any stridor or anything?
Yes.
You do? I do hear stridor?
Stridor and
Okay.
wheezing.
I'm gonna ask, is he choking? Are you choking right here?
He says he's not choking.
Not choking? Okay. So likely just a obstruction inside of the tract here. So what I'm going to do is I'm going to think about transporting. Do I see a parent or anything around?
Parents standing right there too.
Okay. I'm going to ask them, does he have any medical history? Because he might not know.
He has a. The only thing he's seen is allergic to peanuts and bees.
Okay. Has he had any bees or peanuts around him?
I hadn't seen him eat a bee, but we were playing out in the park, and
Okay.
he had no peanuts either.
Do I see any signs of anaphylaxis? I'm obviously seeing respiratory distress. Am I also hearing? I'm hearing stridor. Do I see any puffing of the chest?
You see slight swelling, and the redness of the skin is getting more vibrant.
Okay. Has he taken his epi before?
He is not. He doesn't have an epi.
He doesn't have an epi. Okay. I'm going to either get an auto injector, or if my protocols pertain to it, I'm going to get an ampule and start getting that ready. I'm going to get 0.15 milligrams and inject it into the anterior lateral thigh here. After, I'm going to get some more vitals and ask my partner to get the vitals for me. After about 3 or so minutes, we should see some major improvements. What improvements am I seeing? I'm going to see vitals, blood pressure, respiratory rate, skin condition. I'm also going to ask for glucose.
The O2 sat comes up. He's feeling better. He can speak for longer durations of time. The swelling seems to be going down, and the skin is not near as hot, and the heart rate is beginning to come down slightly.
Okay. I'm gonna ask him, did you see a bee, or did you eat any peanuts or get into contact with peanuts?
He said he saw a hive and wanted the honey and stuck his hand in there.
Okay. So we're going to be transporting code 1 or code priority 1 to the next hospital. I'm going to try and get some more vitals from them, see what putting him on an O2 non-rebreather is for the face mask, 15 liters per minute.
On a non-rebreather, he's sat at 98 right now.
98. Gave him 0.15 milligrams. Okay, what about the blood pressure?
Blood pressure is coming down. It's around 130 over 85 right now, 86.
Okay. And I'm going to get a glucose. What would the glucose be?
Glucose is sitting around 115.
150. Okay. All right. And respiratory rate, what would we say that is?
It's about 18. It's still a little rapid, but he's just trying to catch his breath.
Okay. Is it labored?
No.
It's not labored. All right. I'm going to reassess every 5 minutes, even though he is stable from what it looks like. But I'm also going to get a secondary assessment like what I've been doing with the vitals. Going to see if he has more accessory muscles being used. I'm going to see nasal flaring. Going to ask if he has any, or look and see if he has any JVD or anything like that. Palpating the skull, looking for battle, looking for raccoon eyes, anything that would indicate something else. Going to get a pulse again, see if it's any strong or thready. Going to palpate the chest here, palpate the stomach, see if there's any tenderness or retractions.
You don't notice any.
Okay. Pelvis, he's good. Palpating the leg here, other leg. Genitals are fine. Palpating the left arm and palpating the right arm. Do I see anything else up top right now?
You notice some scrapes on the arm from when he fell back.
Okay. Is there any bleeding that I need to be worrying about?
Just a little bit. It's not.
Just a little bit?
It's nothing
Okay.
crazy.
I might patch that up real quick, but I'm also going to look at his back here, if there's anything wrong about it, and palpating it. Do I feel anything?
No, you just notice some abrasions. That's about it.
Okay. And palpating the butt if I need to. Now, at the hospital, I can give a patient care report. I have a child here, was playing in the park, went into a beehive. He has a history of bee allergies. Originally, he was having an anaphylactic reaction, so I gave him 0.15 milligrams of epinephrine at this time. After I got a set of vitals and they looked like 98 after non-regular oxygen administration, 15 liters per minute. We have 18 respirations, not labored. I have 130 over 85 blood pressure and 115 pulse. That is strong and not thready. Everything else, skin condition is fine, but task complete.